Next module, impact of non-compliance on career development. Non-compliance with health laws and regulations in the health information technology sector can have significant consequences, not only for healthcare organizations but also for individual professionals. Understanding the potential impacts of non-compliance is essential for those aiming to build and sustain successful careers in health IT. This module explores the ramifications of non-compliance, including legal, financial, reputational, and professional consequences, as well as strategies for mitigating these risks to support career development. Firstly, legal consequences of non-compliance. Failure to adhere to regulations such as HIPAA, high-tech, and state health laws can result in substantial legal repercussions for both organizations and individuals. These include fines and penalties, legal action, and criminal charges. Firstly, fines and penalties. Regulatory bodies can impose hefty fines on organizations found to be in violation of health laws. Penalties may vary based on the severity of violation, and repeat offenses can lead to increased fines. Next, legal action. Non-compliance can expose organizations to lawsuits from affected patients or regulatory agencies. This could involve costly legal defense, settlements, or damages, impacting not only the organization but also the careers of individuals involved in compliance violations. Next, criminal charges. In extreme cases, willful neglect or intent to commit fraud can result in criminal charges against individuals, leading to the possibility of incarceration, which can have a lasting impact on one's career. Next, financial consequences. Non-compliance can have dire financial implications for both healthcare organizations and individuals. These include increased operational costs, loss of revenue, and funds for training and remediation. Firstly, increased operational costs. Organizations facing compliance issues often incur significant costs related to audits, investigations, legal fees, and enhancements to security measures after finding vulnerabilities. Next, loss of revenue. Regulatory non-compliance can result in loss of business, particularly if patients choose to seek care elsewhere due to concerns over privacy and security. Lower patient trust can impact an organization's bottom line. Next, funds for training and remediation. Organizations may need to reallocate funds to train staff on compliance requirements or to remediate issues identified during audits, diverting resources from other critical areas. Next, reputational damage. The reputation of a healthcare organization can be severely affected by non-compliance, which consequently impacts professional careers. This include loss of trust, negative media coverage, and impacts on career advancements. Firstly, loss of trust. Patients and partners are less likely to trust healthcare organizations with a history of compliance violations. Eroding trust can hinder long term relationships and lead to decreased patient engagement. Next, negative media coverage. Incidents of data breaches or non compliance violations often attract media attention, drawing public scrutiny and damaging the credibility of the organization and its professionals. Next, impacts on career advancements. For individuals working for organization with reputational issues may limit opportunities for career advancement. The stigma associated with non-compliance can affect professional networking and job prospects. Next, professional consequences. The ramifications of non-compliance extend to the careers of health IT professionals. These include job security, limited career progression, and impact on professional certifications. Firstly, job security. Employees may face job loss or termination if their organization is found to be in violation of regulations. Accountability for compliance often extends to specific roles within the organization, and professionals may be held responsible for lapses in their duties. Next, limited career progression. Professionals who work for organizations with a history of non compliance may find it challenging to advance their careers, as potential employers may view working in a non compliant environment as a red flag. Next, impact on professional certifications. Non compliance issues can lead to increased scrutiny from certifying bodies. Health IT professionals who hold certifications may face revocation or have difficulty renewing credentials if their organization fails to meet compliance standards. Next, mitigating risks and supporting career development. Understanding the consequences of non compliance emphasizes the importance of proactive measures to mitigate risks. These include continuous education and training, creating a culture of compliance, staying informed, and building a compliance focused career. Firstly, continuous education and training. Regular training on compliance regulations and best practices is essential for all team members in health IT. Investing in professional development helps ensure that individuals remain aware of legal requirements and organizational policies. Next, creating a culture of compliance. Health IT professionals should advocate for a culture of compliance within their organizations, encouraging open discussions about regulatory responsibilities and ethical considerations. Next, staying informed. Staying updated on changes in laws and regulations is crucial for maintaining compliance and ensuring that all practices are aligned with the most recent standards. Next, building a compliance focused career. Professionals can enhance their career development by pursuing certifications focused on compliance, such as Certified Information Systems Auditor or HIPAA privacy and security certifications. This demonstrates a commitment to understanding regulatory landscapes and adhering to best practices. In conclusion, non-compliance with health laws and regulations can have profound impacts on both the healthcare organizations and individual professionals in the health IT field. Understanding the legal, financial, reputational, and professional ramifications of non-compliance is crucial for those working in health IT. By actively engaging in compliance efforts, pursuing ongoing education, and promoting a culture of ethical behavior, health IT professionals can mitigate risks associated with non compliance and reinforce their commitments to patient safety and data integrity. This proactive approach not only safeguards organizational reputation but also positively influences career trajectories. Below is a deeper examination of the impact of non-compliance on career development for professionals in health IT. These include professional reputation. Non-compliance can seriously damage a health IT professional's reputation within the industry. These include stigma associated with non-compliance and long-term career implications. Firstly, stigma associated with non-compliance. Working in an organization with a history of regulatory violations can stigmatize individuals associated with those violations. This stigma can deter potential employers from considering these professionals for future job opportunities. Next, long term career implications. Once a professional is associated with non compliance issues, it may take a considerable effort to rebuild their reputation and regain trust within the industry. Those who have experienced scrutiny may find themselves on the periphery of career advancement opportunities. Next, legal and financial implications. The legal and financial consequences of non compliance can extend beyond the organization and negatively impact individual employee career paths. These include personal liability and job stability. Firstly, personal liability. In cases where non compliance leads to significant breaches of federal or state regulations, individual employees, especially those in leadership roles or specific compliance roles, may be held personally liable. This could result in fines, legal repercussions, or even incarcerations, depending on the severity of the breach. Next, the job stability. Professionals employed at organizations that experience non compliance penalties may face job insecurity or layoffs, as financial repercussions often lead to restructuring or downsizing. Next, changes in career opportunities. Non-compliance can impact the range of career opportunities available to health IT professionals. These include limited job offers, high-level positions, or and transition to other fields. Firstly, limited job offers. After being associated with a non compliant organization, individuals might struggle to secure job offers in other healthcare settings. Recruiters and hiring managers often look for candidates with a proven track record of compliance and ethical practices. Next, high level positions. For professionals aspiring to reach managerial or leadership roles, prior involvement with a non compliant organization can act as a barrier. Accountability for compliance is often seen as a key trait of effective leaders in health IT domain. Next, transition to other fields. If professionals face barriers to advancement in health IT due to non-compliance, they may decide to transition to other fields. However, transitioning may require additional training and certification attempts to demonstrate their commitment to ethical standards in a new environment. Next, strategies for mitigating non-compliance impact. Acknowledging the potential impact of non-compliance on career development empowers health IT professionals to take proactive measures. These include education and certification, engagement in ethical practices, building a professional network, and staying informed. Firstly, education and certification. Pursuing certifications related to compliance can bolster credentials and demonstrate a professional commitment to understanding regulatory requirements. Certifications such as certified in healthcare compliance or certified information privacy professional can enhance professional standing. Next, engagement in ethical practices. Adopting a strong personal code of ethics and engaging with compliance initiatives within their organization underscores a professional dedication to maintaining high standards. Next, building a professional network. Actively networking with the health IT and compliance communities can provide opportunities for mentorship and support, helping professionals navigate challenges related to non-compliance. Next, staying informed. Keeping abreast of regulatory changes and compliance best practices through continuing education can equip professionals with the knowledge required to uphold standards and advocate for best practices in their organizations. In conclusion, the impact of non-compliance with health laws and regulations on career development in health IT is significant and multifaceted. Health IT professionals must recognize that their involvement in non-compliance can have lasting consequences, influencing their professional reputation, job stability, and future opportunities. By fostering a culture of compliance, engaging in continuous education, and developing a strong ethical foundation, health IT professionals can mitigate the negative effects of non compliance and position themselves for long term success in the industry. Understanding the importance of adherence to regulations not only benefits individual professionals but also contributes to the integrity of healthcare organizations, ultimately leading to better patient outcomes and a more trusted healthcare system. Through these efforts, Professionals can ensure that compliance is embedded in their career development strategies, promoting a healthier workplace and fostering trust among patients and stakeholders alike. Thank you.